walk me through when you start with a patient, sort of walk us through what kind of steps that you go through first, and then we'll kind of break it down into smile and teeth and function and bite and all of those things.
Yeah, it's a pretty complex world, when it comes to prosthetics and just restoring function and aesthetics and all of that. But like you said before, implants are a huge part of this whole process, but the restorative portion of all of this is, I think, in the patient's mind, 95% of the whole experience. Yeah, the surgery should go smoothly, quickly, hopefully pain-free, but what happens afterwards is the major part of all this.
What's the biggest or most exciting visit that you typically see with a patient after surgery? Is it the first chance that they have at looking at teeth? Is it the finished product and being able to see that? Or is it somewhere in between visits where, in our particular process where they're doing a couple sets so that they get to see them? Is it a matter of when they first see them and they're kind of coming to fruition, right? Where in that process is...
It's a little bit different for everyone, but I think for the most part, the final reveal is when we get the most emotion, that feedback.
Is that because do you think that is because it's the end of the journey for them?
Yeah, it's like a weight lifted off their shoulders. It's wow, I made it. This is real. It's not just a plastic prototype, which are really great, but when they finally feel that final, set of teeth in the nice, smooth material, and it just feels like they just feel back to themselves, really.
What part of the process for you on your side is the most difficult to overcome? Is it something intangible like the patient's significant other that wants it a particular way, overcoming that? Is it speech? Is it look? Is it shape? Is it bite? What's the hardest part for you to overcome?
I would say dealing with their emotions really throughout the process. Kind of letting them know that we're in this together. And although it's not perfect right now, maybe today, the day after the surgery, we're going to get there eventually together. So I think repeating that throughout the process and just calming down just their mental attitude, you have to trust the process and just relaying that. I think sometimes that's the hardest because, you're in pain after the surgery, and the first set of teeth, it's not 100% just right yet.
Yeah.
And so keeping that in mind, you kind of have to just calm your nerves a little bit and trust that we're going to get there in a couple days. It's only a couple days away. But just getting through those couple days, it could be a roller coaster.
And you're pretty good at that because you've got, I would say it's probably because you have a bunch of siblings. And so you're used to kind of being tested.
Yeah,
You're very go with the flow and very comfortable with it. That and thinking back to the times, hundreds of times I've done the tooth side of it as well, it is hard to try to communicate with a patient who is in pain, who just went through this big procedure, that everything's going to be okay. And, they might be on a 10 and you're sitting down here at a 3 and you can't figure out why you're struggling to communicate properly with them. Keeping in mind that they're in pain can be very difficult to overcome and constantly be thinking about.
Right. It can be easy to forget. It was a, pretty big surgery. They're still in recovery. They're in it. They're in the thick of it.
Yeah.
So
looking back on my career, and that doesn't even have to be full arch, just a regular single implant that a patient was having a hard time with the pain or whatnot from, you think, my goodness, Mrs. Smith and I are never going to get along. It's never going to happen. And next thing you know, that pain breaks and they're your best friend. So keeping in mind that in a few days they'll be back to being your friend and communication during that process is important.